Hi, I'm Betty Lynn Fisher. I'm the consumer columnist and medical reporter with the Akron Beacon Journal. And today we're here with Dr. Ray Bologna, who is the chair of the urology department at Cleveland Clinic Akron General. And we are coordinating today during COVID for healthy actions. Thank you so much, Dr. Bologna, for joining me today.
Hi, Betty. Thank you for this opportunity.
Sure, and this has been a little bit in the making. You and I actually had this ready and early March before this all happened. So thanks again for being flexible. So we're going to talk about a topic today. I won't go over everything that's in the column, but the column today is talking about female bladder issues. You are a female urologist. And so this is a topic that may make people blush. I'm going to try not to blush too much while I'm asking some questions. But obviously something that a lot of people do have. 1 in 3 women have some type of bladder issues in terms of urinary urgency and incontinence. So like I said, we won't go over everything. We'll let people read the Q&A that they can read at. You can read it at www.tinyurl.healthyactionsabj. And that's a list of all of my healthy actions topics. I think I'm on my 3rd year now with this. But let's start a little bit. We're going to dive in a little bit more. We talked about in the column about various treatments when you do have some of these issues. And one of the treatments is using mesh. And you said that this is a question that you get a lot from people. So can you talk to me a little bit about what the question is that people have and what your typical answer is?
Sure, and mesh repairs have been used for several years, and many people are concerned about the use of mesh because of some events that happened a number of years ago, and everybody heard about the lawsuits that were involving mesh. We still do use mesh routinely. There are ways of doing procedures with and without mesh, and I think you need to talk to your provider about that and see what the best treatment options are for you. The 2 most common places that we use mesh now are directly underneath the tube you urinate through to help treat stress incontinence, the leakage when you cough, sneeze, and lift. In that case, it's a very small piece of mesh that gives you that extra support. But the reason we continue to use it is because the risks of using it are so low and the outcomes are so good. The risk of using mesh is probably around 3%. And the biggest thing we worry about is if for some reason that small incision underneath the tube you urinate through doesn't heal well, then you may potentially feel an edge of that mesh and you need something done to correct that. But because that risk is low and because the outcomes are close to a 95% dry rate where somebody is no longer leaking, dry or improved rate, we feel that the use of mesh is safe. And all the societies that look at this, both on the urology side and on the OBGYN side, feel that it's safe to still offer that. If somebody's concerned, we can do a repair to help treat stress incontinence by using their own tissue. We can take a small piece of their rectus fascia, or their support tissue on their belly, a small piece actually what makes your 6-pack, and steal a small piece of that and use that as your sling or as your support underneath the tube you urinate through. So those are 2 of the more common things that can be done for stress incontinence. Where a lot of people get concerned and where a lot of issues came up were these large pieces of mesh that were being used for support of the bladder or support of the top of the vaginal area, and they were being put in through a vaginal incision. Those have a complication rate close to 30%. And so those are no longer used. So nobody has to worry about that. We don't do those procedures. We still may use a piece of mesh at the top of the vaginal area, but it's put in outside of the vagina and not through a vaginal incision. And again, the reason for that is to give somebody enough support so things don't come back down in the long run. But there are ways of giving folks support at the top of the vaginal area using their own support tissues. And it's really just a discussion with the patient whether or not they feel comfortable using a mesh and what's the benefits and what's the risks.
Okay. A couple other questions I have are more gynecological, but since we're talking about all of this, let's go there. Can you tell me the difference between urinary tract infections and yeast infections in terms of symptoms and medically?
So urinary tract infection is a bladder infection. And in our world, we always talk about bladder infections, urinary tract infections, lower urinary tract infections. And all those pretty much mean the same thing, a bladder infection. So a patient will experience more frequency, urgency, burning with urination, maybe some lower belly discomfort, but they typically won't have a fever. And so those are usually a bacteria, the most common one being E. coli. And it's not uncommon for a woman to get a bladder infection. Sometimes we say that up to 2 infections a year is normal.
Hmm.
Um, Yeast infections, although you can get a yeast infection in the urine, it's much more common to get a vaginal yeast infection. The difficulty there is those symptoms can be very similar. You can have some burning with urination, some discomfort. So sometimes it's hard to tell the difference. The biggest difference is typically a urinary tract infection is going to give you the burning discomfort, maybe a little bit of blood in your urine, but you should not get any vaginal discharge with a urinary tract infection. But occasionally, like I said, we will see yeast infections in the urine, but not very common.
And then don't yeast infections usually also have kind of itchiness as well?
Right. You know, the itching, burning, discomfort, and discharge.
So that will usually signal the yeast infection as opposed to the urinary tract infection?
Correct.
Okay. What about prevention? Can we talk a little bit about, how are ways that you can just avoid these?
So we deal with preventing urinary tract infections every day. We'll see new patients with recurrent UTIs. Interesting, most women get some bacteria in their bladder every day. If they're urinating normally, the bacteria comes out, you don't know the difference, and you just move on with life. The biggest factors in prevention is number one, drinking enough water. So if you're drinking enough water, you're going to flush any bacteria out, you're going to urinate more frequently, and that's going to help prevent them.
Is that like the 8 cups a day, or what's the?
Yeah, I love that 8 cups a day thing because it's so different. So if you're in your house doing Zoom calls all day, you probably don't need as much water as somebody who's out working in the yard all day.
Okay.
So the other rule of thumb there is that your urine should be relatively clear.
Okay.
If it's dark and concentrated, then you're probably not drinking enough. So, but yes, the 8 cups a day has been the rule that everyone's been living by for quite some time now.
Okay.
But it does help. Drinking enough fluids, you're going to urinate more, any bacteria is going to come out, and that's going to help you prevent them. The other big prevention thing that we see, or the time we start seeing more urinary tract infections, is when somebody gets close to being postmenopausal. So as your estrogen levels come down, your lactobacillus, the good vaginal bacteria, goes away. And that changes the vaginal environment, and that gives other bacteria more opportunity to give you a bladder infection. So on the prevention side, as soon as somebody gets postmenopausal, we start seeing more infections. That's when we'll start them on a little bit of estrogen cream. That can make a huge difference. There's estrogen receptors within the bladder. It can help prevent UTIs. It can reduce some of the urinary frequency and urgency. So that can make a big difference for folks. And because the amount of estrogen that's being used is so low, we don't worry about the systemic side effects or the concerns that folks have with cancer and using estrogens.
Okay.
Other little simple things that you can do, we know that vitamin C, 1,000 milligrams a day, makes your urine a little bit more acidic, and that can help prevent bladder infections. Cranberry pills, not cranberry juice, that can actually help prevent some infections.
You mean like literally, like, is it like a vitamin?
Yep,
what do you mean?
like a vitamin.
Oh, okay. And so what about cranberry juice? I've heard about cranberry juice before.
So cranberry juice doesn't have enough of the beneficial factor that you get in the cranberry pill. So what you want from the cranberry, the juice actually doesn't have enough.
Oh, interesting. And so this is something that you could just on a daily, on a regular basis, just if you're prone to UTIs.
Yep, you can just take the cranberry pills. And so the thought there is what's in the cranberry actually prevents, this sounds bad, but actually prevents the bacteria from grabbing onto your bladder lining, which is kind of what's happening when you're getting a bladder infection.
Okay. So
for a lot of folks, we increase their fluids, we put them on vitamin C, cranberry pills, estrogen cream if they're postmenopausal.
I'm sorry, is there a certain dosage of the cranberry pills, or?
And that's a tricky one because, you read the bottles from all the natural ones and everyone's different. They tell you to take 2 a day, 4 a day.
Yeah.
I think you kind of go by the bottle that they give you.
Okay.
But usually for our folks, we usually have them take at least 1 twice a day.
Okay.
So vitamin C, cranberry pills, estrogens if they're postmenopausal or perimenopausal, and fluids tend to be what help folks the most. I mean, we can prevent a lot of urinary tract infections just with that alone. The other side of the story is making sure that there's nothing anatomically wrong that's causing somebody to get an infection. Are they not emptying their bladder well enough? Do they have a kidney stone that they didn't know about? So for a lot of people, if we're not getting anywhere, we will image their kidneys to make sure everything's normal. We will ultrasound their bladder to make sure they're emptying well. So we just want to make sure all the anatomical things are fine. And to go along with the article, we want to make sure that they don't have any prolapse. Make sure their bladder isn't dropping down and that's causing them not to empty well.
Okay, okay. And then what about prevention of yeast infections?
So that one's a little bit trickier, and there's a lot of information out there regarding probiotics, being cautious if you are on antibiotics, because if you're put on antibiotics for anything else, that's what's going to lead to urinary tract infections. A lot of things out there about, not wanting to sit around in a wet bathing suit all day this time of year, making sure that you're changing your underclothes on a regular basis. I know you mentioned cotton underwear. A lot of people find that does help. Okay. So a lot of simple things that you can do.
Okay.
And we've also found that probiotics, not only in the prevention of urinary tract infections and yeast infections, for both, it can actually be helpful.
Okay. What about in terms of, which direction should you wipe? Is that, to try to keep the bacteria out? Is that?
Front, back, and drop. Always been the rule. Front, back, and drop.
Okay. Okay. And then also, is there any helpful, is it helpful after intercourse to go to the restroom, drink some water?
All of the above. So that's something, we often talk to folks about what are their triggers? When do they seem to get bladder infections? And so for a lot of women, it's any time they change their habits or anything that can change the vaginal environment. So interestingly, constipation is a big part of it. So if somebody's constipated or if they're having loose stools, that puts them at a higher risk for bladder infections. For a lot of our folks, when they travel, things can change. Their habits change, and the next thing you know, they get a bladder infection. Nowadays, everyone's driving everywhere. Nobody's flying. So when you're riding in the car, folks tend to stop less, and they don't urinate as often. And so the next thing you know, they get to their destination and they have an infection. Intercourse is one you can talk about a lot. There's been a lot of articles written. People feel that it has nothing to do with bladder infections. Some people swear that every time they have intercourse, they get an infection the next day. And that's a tough one because sometimes it's just irritation. It's not so much an infection, but it's just irritation. So if we determine by getting urine cultures, which is probably one of the most important things, that somebody gets a culture whenever they think they have an infection, so we know what's going on. If they truly are culture positive, and it seems to always be after intercourse, a lot of times we'll prophylax somebody, but they'll just take one antibiotic after intercourse and just avoid getting a full-blown infection.
Okay. Okay. Final question. Sorry, go ahead.
I was going to say, when it comes to recurrent urinary tract infections, getting cultures for us is very important, because then we know, is it an infection or is it something else that's going on?
Okay. And then just final question I had was, can you talk a little bit about the age range for urinary issues? You were talking a little bit about how, there may be, as females age, there may be different triggers.
I think the age range from what we see in the office is everything from college age kids on up to our 80, 90-year-olds. It's really amazing. And you'll even see little girls who often have symptoms even in grade school, where they get the frequency and urgency, and that's often bowel related. Any little child that's a holder all of a sudden who has constipation has bladder issues. Then we seem to see a population of younger women, college age women, who get a lot of frequency and urgency. And that tends to be more related to diet changes, lifestyle changes, the stress of living in a dorm and things like that seem to happen. And then we get our group that's after childbirth. That's when we start seeing more of our stress incontinence, the coughing, sneezing, lifting, leakage, more of the frequency and urgency issues of going. And then, in there somewhere, you start seeing the recurrent UTIs. And then once folks are getting a little bit older, they've had children, then we start seeing more of the leakage issues, more of the prolapse issues, things coming down and losing support. But it does affect every age range, and it's certainly challenging for folks.
Great. Thank you very much for joining me today and for talking about this topic that a lot of people don't necessarily want to talk about, but I think it's important for people to know about. So we really appreciate you taking the time and joining me.
Thank you. Take care.